Thanks. I would like to welcome you all, and we can move to the second slide. I would want to start very briefly with a couple of words about myself. I work at the Learning Lab at the University of Applied Sciences at Arts Northwestern Switzerland, and my research and innovation projects, they are particularly focused on the use of digital media for learning, collaboration, all kinds of knowledge processes, and I have a particular interest in the field and domain of global and public health. Next slide, please. And today, in this short presentation, I would want to talk about digital communication, communication in global and public health enabled by digital media. And I will focus on conversational technologies, including social media, Web 2.0, and at the later part, I will also talk about intelligent digital assistants that we are developing and researching at the moment. But I would want to start really with the fundamental question: why are digital network conversation on social media so powerful? And there are many answers to this question, and I would want to highlight three of them, according to my understanding, the most crucial ones. And they are reach, speed, and also the third one is trustworthiness. And reach and speed are, of course, interconnected, and they're very much linked to networked and nearly, let's say, boundaryless communication. Let me explain. So information on networks, on digital networks, and this is the underlying foundation of social media, spread much further and quicker than any other communication channel. An idea which is expressing this quite nicely is the 6 degrees of separation, which you might perhaps know. This idea basically says that there are just 6 or even fewer social connections that you are away from any other person on this globe. So in other words, you know someone who knows someone who knows someone and so on, who knows President or ex-President Trump. Well, that was my very short reference to the ongoing political situation. However, the point is really that with this kind of digital media, communication is getting much, much quicker and reaches out further than any other communication channel before, and this is what makes it so powerful. And after reach and speed, we have another very relevant characteristic, and this revolves around trustworthiness. Trustworthiness means that the information which is not just being shared by anybody on social media, but we receive the information from people whom we already trust. So it's forwarded between actors who trust or who know each other. And this is what it makes it so powerful, but also dangerous, as I will come back to this. So to put it in a very bluntly provocative way, perhaps, untrustworthy information is shared among people who trust each other. Next slide, please. But first, I would want to talk about the benefits and of the use of digital mobile social media, and we have been researching a lot in this field. There are many of them, and in short, we found that if social media is used by health professionals, health workers, in a responsible, sensible way, then it can make them more knowledgeable, it can make them better connected, more resilient, and we have also used these tools to manage health workers and health professionals distributed in some geographical space, rural countrysides, more effectively. So in the last 5 years, I've focused particularly on one technology, which is very broadly used in global and public health, and this is instant messaging. So the most well-known application is probably WhatsApp. And our research from many sub-Saharan African countries says that WhatsApp is indeed the most relevant tool that nurses, midwives, and other health professionals are using. So the most relevant communication tool that they have, and they use it to organize all kind of work. So this is really the most, by far the most relevant communication channel in many, many settings, and not just including sub-Saharan Africa. Next slide, please. We can, in addition to, let's say, the informal day-to-day use, also use social media systematically. So we can leverage social media Web 2.0 platforms. And this is what we have also done in addition to the, let's say, more basic research in many countries in sub-Saharan Africa. With this, I mean the systematic, moderated or managed use of such social media groups and platforms, especially on instant messaging platforms, but also on other social network sites. And one example that I can give you is that we used, for example, WhatsApp groups in Nigeria, South Africa, and Zambia to allow a better transition of young nurses, young professionals from schools into the workplace, which is probably, or we know this, is the most critical developmental phase in the journey of these young professionals. And these groups, they were moderated by more experienced nurse professionals, and we did this with thousands of professionals following a certain online curriculum. This curriculum was prepared by our team from the local sites. And the results that we have shown empirically is that these young professionals in the WhatsApp groups, they had enhanced knowledge, they had increased resilience and reduced professional isolation and less stress in the application phase, in the face of great uncertainty in comparison to the control groups that we have set up. There are many more examples from other projects saying something about the benefits and forms of usage, and we have documented some of them also in a publication together with colleagues from the Johns Hopkins Bloomberg School of Public Health, and I think you can see it on the next slide. Exactly, yeah. Good. And then on the next slide again, I will briefly discuss a couple of considerations regarding what we can or should consider in the setup and preparation of these social media spaces if we would want to use them more systematically. And the key thing really is to make these social mobile media spaces, WhatsApp spaces and other spaces, local spaces from the very beginning, fostering local ownership, putting the local community health workers, the supervisors, etc. in the driving seat. So this is really very much about ownership. In contrast, a top-down approach managed by Western health experts who coordinate the local health work is not the most promising thing to do, as it goes against the very nature of the peer-to-peer characteristics of such spaces. Another point is that as social media and instant messaging are inherently private personal spaces and not necessarily being used for professional or health-related aspects, it is particularly relevant that all participants need to agree on the scope and on the purpose of the groups. So this is something which has to be done in the form of co-development, including the question what, when, how to communicate. It sounds very trivial, but we have seen that there is so much conflict and or potential conflict in many of the settings that we have researched. There are many, many more moderation facilitation guidelines which we have also collected, and I'm happy to share them with you. But now, and on the next slide, please, I would want to turn to the dark side of social media, because there's one thing which is very central. Regardless of whether we want to push the use of these tools, of these social mobile media tools in our projects or not, we have to consider that health workers will use or already use them on a massive scale. And this scale is really massive. It's in many contexts the most prolific work tool that they have. And I already spoke about the benefits that this might be linked to, but there are a lot of risks and challenges associated with this informal use of social media spaces as communication tools in global health. In the next minutes, next slides, we would want to focus a little bit on them. We have developed a report in which we've tried to systematize the main problem areas of social mobile media use, and we have drawn particularly on our experience in sub-Saharan Africa, including Nigeria, Zambia, South Africa, and Malawi. And you can see, let me cross-check the main problem areas already on the next slide, I guess. No, 2 slides back, sorry. Yes, here we go. So these are the key problem areas that we have identified, and we've come up with a report. And just I would want to very briefly focus on 2 relevant areas. And the first one is really that many health workers they are breaching clients' privacy and confidentiality by using these tools. And this is something that happens, unfortunately, very often in more or less subtle ways. And in many cases, health workers are not even aware of that. And the second point is that the proliferation of health-related misinformation is a really big issue of our time, not just in low or middle-income countries, likewise in higher income settings. And research really says that misinformation, false news, fake news, they're spreading much further and faster than the truth on social media spaces. And this can have, as we have experienced, devastating health consequences. And we must acknowledge that, if you like it or not, global and public health is not something that takes place outside of digital media, but social media, mobile social media, is exactly where global health conversations take place, shaping and unfortunately also many times biasing people with potentially devastating consequences. Now the next slide, please. What can we do against this? And I think in the light of the many pitfalls, the digital pitfalls, it is incumbent on us to help make health workers and health professionals fight digital misinformation, or at least preventing them from further spreading it, which is also in some instances the case. And in the first step, we need guidelines and policies in these settings. And we need also to prepare and to train health workers, health professionals regarding digital professional literacy. And this is what we did, for example, when we developed social media guidelines for Zambian nurses and midwives together, or in cooperation with the Zambian Nurse and Midwifery Council and Health Ministry, drawing exactly on the prior report. And you can, of course, also download this report and the guidelines. The next slide, please. Thank you. And what we also did is that we developed simple scenario-based digital tutorials, mobile learning tutorials, to train health workers about the most fundamental and basic aspects to consider with regard to digital professional literacy. And we've tested this effectiveness with the randomized control trial. So this is just one tiny step into direction, but I would argue that digital professionalism needs to be integrated in all kinds of education levels, pre-training, and further education as well. Next slide, please. Last but not least, I would want to talk about the more recent strand of my work here, in which I try to explore how digital conversations can be automatized, so connecting artificial intelligence with social media, with social mobile media. More concretely, what we are doing at the moment is developing and testing quite intelligent chatbots, which work on simple instant messaging platforms such as WhatsApp. And we do this in two separate fields: supporting patient care and educating and training health professionals. Let me make this a bit more concrete. So what we do in these two projects in which we collaborate with the Medical College of Ibadan in Nigeria is that we develop a WhatsApp-based chatbot as the front end, of course, which trains nurses regarding HIV, topics of HIV. So this is the first test case. And what we know for many years, the training by using intelligent assistants is effective. It can work. But what we now can do is, if we integrate these training chatbots, intelligent assistants, tutors, coaches, however you would like to call them, we can reach many more people than on other more separate applications which would be needed to download. And the other aspect is that we have developed a second WhatsApp chatbot, I call it now, so in a very simple form, which supports HIV-infected young people in Nigeria. The WhatsApp chatbot can, like a real coach, like a real mentor, provide first social support, so drawing on cognitive behavioral therapy. It can also act as a reminder for medication and clinical appointments. And thirdly, the bot is also able to respond to the user's question about HIV. So there's really a trend towards the use of chatbots in global and digital global public digital health, of course. And for example, in South Africa, the government is now using WhatsApp to offer a chatbot that responds or that is able to respond to basic questions about COVID-19. Well, with this short and rather incomplete overview, but some key insights, I would want to complete my talk. On the next slide, that you can see that we are open to collaborate. We're collaborating in networks of stakeholders. So if you wish, if you have a good and innovative idea, we're always happy to put something up. Then on the next slides, you see some practice resources, practice articles, practice summaries. On the last slide, you see a number of underlying scientific publications. Well, thanks a lot for listening, and I give back to you.
Thank you so much, Christoph, for this very interesting talk and lots of insights on mobile applications, which is very useful for our network because that has been a topic within our various meetings we had. The presentation will be uploaded to our resources, so you can access the information there later today or tomorrow, and we will send it out through by email. So all of the information will be shared later on. So I think we have one more, we can have one or two questions before we move on to Neda. Okay, who wants to have a question? Maybe you just type in the question because we don't have time to... Okay, someone says, I would argue that building a system with digital tools which are known for not guaranteeing crucial human rights such as data privacy, e.g. WhatsApp, today your user could simply not be considered as options for these implementations. Now, I'm not sure to what that relates to.
Well, the other option is, of course, using like separate tools, developing separate tools, but then there's the question of sustainability. So I've seen many apps who have just survived the project time and then have vanished into nothingness. And of course, there's always we have to strike the balance. What would we really want? And there are many pitfalls regarding the use of WhatsApp and others. And this is, for example, why the NHS, the British health system, has banned the use of WhatsApp. And then all of a sudden their entire system has nearly collapsed. And then we're very glad that nurses in this particular context, they have started or continued using WhatsApp, and with this and other applications which one might not consider to be secure. And with this they could maintain until the other regular system has been repaired and was up and running again. But the thing is, if you look in many countries, in middle-income countries, there is WhatsApp is really the number one communication tool, whether we like it or not. And the least thing we can do, as I argued in my talk, is really to make people and to prepare them to use it in a very cautious way.
Yeah, also I'm a total fan of WhatsApp and I like it very much. The only thing which and you mentioned it in your talk, is the fake news. And I think this is very crucial among healthcare workers who may send a picture of the patient, even if you can't see the face, but maybe of a lesion or something, and they want to ask for some help, and they get wrong information or they send out wrong information. So how is there a solution to that?
Well, the solution really is training, because what I've seen in the context I've worked, that there's no kind of training and preparation. So we train our professionals and health workers regarding all kind of skills, how to treat the patient and about communication. But in hardly any context that I've come across, there's a focus on digital professional literacy, what to do, what not to do. And this is why many people are not even aware of that they are breaching the privacy of their clients. So we had one example shortly before we released the policies and the guidelines in Zambia, where we had one I wasn't sure what kind of profession it was, but the medical professionals posting a picture on Facebook showing a long queue saying, well, today I treated over 100 and something people with HIV, and you could see all of the faces of these persons. And this profession, this health worker was not even aware of this. So raising awareness is a starting point, embedding it into training, pre-service training, and ongoing training is something that we have to do, and that I cannot see this yet, or very rarely.
Yeah, thank you very much. A very important point.